Hello everyone. A patient of mine has asked me what is the difference between lupus and rheumatoid arthritis. Rheumatoid arthritis, as we have discussed before, is an inflammation in the joints. It is usually bilateral, symmetrical, and affects the small joints of the body. Most characteristically, the small joints of the hands and feet. And of course, it can affect other joints as well. Usually, patients have related constitutional symptoms like fever, weight loss, a general feeling of malaise or fatigue, etc. Two-thirds of the patients can have positive markers like the rheumatoid factor and CCP, and imaging can show evidence of damage in disease that has already started or progressed. Even in early disease, sensitive imaging studies like ultrasound or MRI can pick up early damage and early changes of inflammation in the joints. On the other hand, lupus or SLE or systemic lupus erythematosus is a autoimmune disease which is characterized by a plethora of symptoms. This can include fatigue, weight loss, appetite loss, rashes, a photosensitive rash or a malar rash on the face, the butterfly rash. Patients can have ulcers in the nose or mouth, hair loss or patchy hair loss leading to bald spots. Patients can have fingertip color changes called Raynaud's syndrome, dry eyes, dry mouth, or Sika syndrome. They can also have fluid building up around the lungs and heart called serositis, low blood counts like low WBC count, low platelets. They can also have swelling and pain in the joints as part of the inflammatory arthritis, and so forth. Patients usually have the positive ANA, anti-nuclear antibody, and they can also have other associated lupus antibodies like the anti-Smith, anti-RNP, anti-chromatin, anti-SSA, SSB, etc. Active lupus patients can have low complements, the low C3, C4, an elevated double-stranded DNA, dsDNA, and also evidence of blood or protein in the urine if they have renal involvement. All patients with lupus do not have all these antibodies or the low complements or the elevated double-stranded DNA. Every patient is unique. So this is in brief the difference clinically and serologically between the patients with RA and lupus. And I forgot to mention, patients with lupus usually do not have erosions on their joint imaging. So the arthritis is called non-erosive. Some patients with these autoimmune diseases can have features of both rheumatoid arthritis and lupus. That is, they can have clinical features suggestive of lupus, but on the other hand, they have some markers suggestive of rheumatoid. And in that case, we call them rupus, or a combination of lupus and rheumatoid arthritis. Ultimately, at the end of the day, we are treating the symptoms, not so much the disease name per se. So your rheumatologist will let you know which are the predominant symptoms, and your treatment plan will be based on that. This is Dr. Nilanjana Bose from Lone Star Rheumatology. Thank you.